Good afternoon. My name is Rosita Stinson. My oral presentation will be about nursing in the correctional setting. I did a study or research and I found an interview that was conducted, and they interviewed a nurse that works in a correctional facility and asked her several questions. And one of the questions that was asked is, what was it like the first time she stepped into a correctional setting? Nurse Mateo's response was, I was really scared. Once I got to know them in the context of my role as a nurse, I realized that caring for guarded care patients is the same as caring for patients in any hospital unit. When one thinks of an inmate, their mind may automatically think that this person is bad. Even though that may be the case for some, everyone that is in jail isn't necessarily a bad person. Prisons house people for various reasons, whether it be for a crime, deportation, safety reasons, or etc. Regardless of the reason, if medical services are needed, they should have the same respect or receive the same respect and services as a regular patient would. I believe that Mary Moose said it best. The fact that the patient is incarcerated is only a circumstance of his or her situation and does not and should not change how the nurse practices or how the nurse views the patient. Correctional nursing is defined as the practice of nursing and the delivery of client care within the unique and distinct environment of the criminal justice system. Studies have shown that there are over 2 million men and women in custody in America's jails and prisons. One of the challenges of being a correctional nurse is that sometimes the ratio of nurses to inmates may be great as 1 RN for approximately 200 inmates. So I can only imagine the need for nurses in a correctional facility has tremendously increased. What do you think? Nurses in corrections have to be able to cast off their bias and follow strict security rules while helping inmates restore and maintain health. Nurses are the gatekeepers to getting prisoners the health care that they need. They are also exposed to individuals with mental illness, aging individuals, women, men, youth, culturally diverse individuals, and each group has their own unique healthcare need. I want to go into some of the roles of a correctional nurse, and you may wonder why I wanted to focus on this. I've worked in the correctional facility for about a year now, and people overlook some of the positions in the correctional facility, and I admire and I respect a nurse that would take out her time or she's went through schooling and to want to work in a field that people run from, which is corrections. So I applaud a nurse or nurses that would take out their time and will actually go into the field of nursing to assist those that are less fortunate. In other words, even though some of them are in there for their own purposes, but some of them may be in there because that's the only place that they can be at the moment. So I applaud anybody that works in a correctional field as a nurse, or anybody that works in correctionals in general. So I wanted to go into some of the roles of a correctional nurse. And some of the roles include ensuring offenders receive decent treatment, minimizing risks to prisons, including infection control, accessing prisoners' health care and service needs, addressing special needs, including any disability, learning difficulties, and language problems, identifying suicide and or self-harm risk, recording information or disseminating it to the prison staff and other agencies while maintaining appropriate levels of confidentiality according to prison policies and nursing practice standards. That's just some of the general roles of a nurse. There are also, as you may already know, definitely some challenges in working in as a correctional nurse. And some of the ones that I found online were that they may have to do dual roles as a caregiver as well as a correctional officer. The lack of respect from non-clinical colleagues as well as the patients that they're seeing. Fear of error brought on by either the pressure of having to work speedily and beyond the typical professional boundaries. Their personal safety, court and legal issues, and also the feeling of being unappreciated. Can you imagine that? But even though the role of a correction nurse may seem stressful, I believe that one of the most positive aspects of this role will be knowing that you have possibly made a difference in an inmate or prisoner's life. Thank you so much for listening to my oral presentation, and I hope that you have enjoyed it, and I hope that I have brought light or insight to the importance of correctional nurses. Have a great day.